Changing company and government policy around fertility care benefits is no easy task, but that doesn't stop Davina Fanghauser. She has successfully helped thousands of individuals who want to grow their families to increase access to fertility treatments and benefits by educating patients, policymakers, and service providers with evidence-based data through her organization, Fertility Within Reach. And today on Lunchtime Live with the Center, we are speaking to Davina about this and about how her work can help you get the fertility care that you need. Welcome, Davina. How are you?
Thank you. I'm great. I'm very happy to be here. Thank you for having me.
We're happy to have you. So, Davina, what is Fertility Within Reach?
So, Fertility Within Reach is a national nonprofit organization that provides or works to provide equal access to insurance benefits for fertility treatment and fertility preservation. Kind of our mantra is to educate, communicate, and collaborate. And all of the tools that we have been created based on IRB research. Everything is, we've asked legislators, employers, and um, insurers, what do they need to support insurance benefits for fertility treatment? They told us, and we've created our tools based off of that information.
Oh, that's fantastic. How did you get started in this?
I was an infertility patient
Mhm. Yeah.
almost 30 years ago.
Wow.
We experienced both male factor, female factor. And in addition, when I would become pregnant, uh, I would usually miscarry. And I had an
Mhm.
undiagnosed blood clotting disorder. And the reason it was undiagnosed was because we had been diagnosed with infertility. Any kind of testing was not covered by insurance. So we didn't know what was going on and we couldn't afford the treatment that we needed. And it took me nearly 12 years
Mhm.
and nearly 10 pregnancies before I had my daughter through IVF. I was a
Yeah.
patient when I started working for Resolve. And then I worked as the advocacy director for Resolve New England, and I experienced success lobbying, but it was one of the most difficult experiences I've ever had. And I thought I needed to do something to help people around the country, make it a little easier for them to help advocate for benefits.
So your experience has really shaped where you are right now in
Oh,
advocating.
absolutely. It just, I feel very strongly that it just didn't need to be that way.
Mhm.
It doesn't need to be this way for people. This is a medical disease that we're trying to treat. And the bonus to the treatment is that it helps us be able to have children. But
Yeah.
it's still, bottom line, this is a medical condition, and we have a right to seek treatment and be able to have access to the health care we need.
Who do you typically work with?
Well, we work with everybody. So for me, I think there are some groups that work globally, and they may work in only a few states a year. Whereas right now, I'm working in 7 states, and they're not necessarily what you would call the easy wins when it comes to legislation or policy. We're helping those in North Dakota and in Tennessee, North Carolina, Maine, anywhere, Nevada, anywhere they say, um, there's an opportunity for support. This is what we have no hesitation to jump in and work with other organizations.
You it's not easy to make changes. So how do you do this? I mean, what do you do you had talked a little bit about IRB research. What do you do to help this change happen?
Well, we go off of not just in our opinion, it should be different. And in our opinion, this is how you can access benefits. We really did the work because we want to make this as easy as possible for
Mhm.
professionals and for patients. I think when we work in a state like, we do so many things. We build coalitions, we create and manage a website for them, we monitor
Mm.
their digital marketing and their social media. I co-author the legislation, we provide talking points, we have strategy meetings, we train advocates, and it's all very high touch, and it almost needs to be, because when it is challenging, you get to a point where sometimes you think, can I do this? Is this worth it? I'm
Yeah.
sacrificing so much, and it really is a sacrifice to advocate at the level that it takes to change policy. And so for us, it's really about empowering people and giving them the tools to be able to do this on their own and with a group.
So what direct services do you provide to,
Direct.
like,
Oh, go
well, what
ahead.
service? Yeah, if someone were to come to you, how do you support them?
So one of the things we do is we provide them with tools. We have something called the Policymaker's Guide to Fertility Health Benefits. And this resource is something to help them communicate with these, what we call policymakers, employers, legislators, and insurers.
Mhm.
And in addition to giving them the tools for communication, we also provide some services if they need additional support. For example, if they have an insurance appeal that they've written, we'll review it and see if there's some research that could be added to support their case. And then we do participate in patient conferences and professional conferences to really help extend the outreach to patients to give them the information they need. And then we provide resources for them to use and utilize as well.
Now, for a state like Connecticut, where IVF coverage is available, and and I'm sure you had some, you did some work with that
Yeah.
many years ago. What's going on in our state that's being advocated at the moment?
Well, at the moment, there is a Connecticut Parentage Act, which we're supportive of. And that really will have the law establish security of the parent child relationship
Mm.
for all families. But I'm actually working with a group called Affordable Families. It's a coalition, and we are looking to update the mandate in Connecticut, or the
Okay.
insurance law in Connecticut, so that it would include third party reproduction. Currently, donor egg, donor sperm, gestational carrier isn't covered. We want to make it more accessible for all patients in need, and that there is no room for discrimination in the law.
Oh, that's excellent.
Mhm.
And so we do have a mandate, but then there are companies that are self-insured companies. So what's the best way um, you know, to have someone who works for a self-insured company? What is it? What can they do to perhaps get coverage?
Well, first they have to ask usually their HR if their company is a fully insured or a self-insured company.
Mhm.
And self-insured insured companies are protected by a federal law that they don't have to provide the mandates. However, so what happens is a self-insured company will hire an insurance company like Aetna to manage their claims, but it's the employer that pays the medical expense. So
Okay.
it actually is really great when you're talking to a self insured employer, because you can really show them the data and the research that explains how you save in outcome costs like high risk pregnancies and multiple births and preterm births, NICU expenses, when
Yeah.
there are benefits provided. And then the other thing is, you can give them examples. Employers want to know which of my competitors, business wise, are offering these benefits. What kind of plan do you recommend? And we have that type of information in our policymakers guide.
Yeah, and so those numbers really help make change
Absolutely.
happen.
Absolutely, because people's stories make them memorable. It makes the issue memorable, but most people stop the decision makers and say, I have a lot of sympathy for you. But people don't want sympathy. They want help getting treatment. So you have to make it easy for them to be a champion for you.
Mm.
Speak their language, help them find a competitive edge, and bring these benefits to your company.
Now, aside from some of the policy changes that uh, you help people with, you help companies with, what are some of the other services that you offer? Is there financial assistance programs as well?
So, next to the policymakers guide, the most popular part of our website is our financial assistance page. We have this, comprehensive list of different grant programs or medication
Mm.
discount programs, all these resources that people can use to try to alleviate the burden of cost or learn about fundraising or financing options. We do have a program, a grant program called Banking on the Future. And we provide a grant which covers the initial cost of storage for adolescent oncology patients and
Mm.
patients who are facing gender transitioning medical treatment. So it helps ease the burden so they can afford to preserve their fertility prior to their treatment. And when we started this program, there was no other organization offering grants to adolescent oncology patients.
That's
And
amazing.
and we did extensive research and we could find no other program that supported those facing gender transitioning. So, we really look to help the underserved with our grants.
And does it only, do you have some services for adult cancer patients as well, or how does Fertility Within Reach support cancer patients that are adults?
So we can provide them with information and resources that they can utilize. We don't have a financial grant program for adult cancer patients. We refer them to where there are. But what
Hmm.
we also do is we make sure when we're writing legislation that fertility preservation benefits will exist
Hmm.
for those with a medical need.
That's fantastic.
Thank you.
You do amazing work. What, so if a patient is trying to get pregnant, they need additional support that you could help them with. At what point in their journey should they be contacting you?
Can you ask that again? What do you mean? I'm
Yeah,
sorry.
I mean, do you work with patients who, if someone wants, at what point in someone's journey do they typically contact you?
Well, if they've gone to a fertility clinic and they find out the cost is prohibitive,
Hmm.
often the clinics will refer patients to me or Fertility Within Reach, not just me, Fertility Within
Right.
Reach. And and then also if they've received an insurance denial, or if they know they have absolutely no benefits and they don't know what to do, they'll go to Fertility Within Reach and either look up the grants or try to learn how they can communicate with their employer. And we support all of those efforts.
And so this is nationwide, not just Connecticut, right?
Yep, nationwide. And all the information is free on our website for people to be able to do it on their own. And if they want additional help, those services are available as well.
You have such fantastic, you're doing such fantastic and life
Mm.
changing work. How can someone contact you? How do they reach out to you?
They can reach out to Fertility Within Reach at admin fertilitywithinreach.org. But I have to say, you know, this organization I think is as strong as it is because we have an amazing board of directors,
Mm,
and the people that we have worked with in the past, we stay connected and they remain supportive, and they want to help others with their advocacy. So it's like this wonderful ripple effect of grassroots. It goes beyond. People don't just stay in their state, they want to help people in other states as well. It's really it is a great collaborative effort to change policy.
yeah. And you have tons of information on your website as well, right?
We do.
So that's fertilitywithinreach.org.
Yes, all one word.
Great. All right. Thank you so much for your time today and your amazing work.
Great to see you. And can I say one more thing? We are so grateful that CARS has been supportive of some of our patients with the Banking on the Future program, where they
Mm,
have been able to bank their reproductive cells at CARS. And we are so grateful to work with you in that manner. So
Can
thank
you
you.
can you talk a little bit more about that program?
Absolutely. So we will be contacted from children's hospitals in Connecticut, and they say they have a patient in need of fertility preservation. And so what they do is they seek the services at CARS, and then Fertility Within Reach pays for that initial um, cryopreservation of their reproductive cells. And it is wonderful to know that there is this supportive, wonderful community. You're not just a clinic, you are
Right.
a community looking after these kids as well.
Mm.
And we're really grateful and proud to work with CARS in this capacity.
Ah, thank you. And you do. I mean, thank you for all your hard work.
Thank you.
All right.
Great
So
to
join
see you.
you too. Join us next week, same time, same place for another lunchtime live at the center. We'll see you then.
Thank
Bye
you.
for now.